Good afternoon, everyone. I know this is a little bit of an odd time right after lunch, so we'll just wait maybe 2 more minutes, let people get comfortable, and then we'll get started, okay? So with today's forum, we have two videos that we're going to show, so not a lot of presenting, but we have some time at the end for good discussion on the topics that you're going to see in the videos today. So the first topic is going to be on marijuana legalization and the impacts that it has on communities, or that it can have on communities. A lot of good information on statistics related to marijuana use, how it impacts adolescents. I do want to warn, the first video has some graphic videos of marijuana use with young children, so just so that you're aware, the first video is pretty strong, starts off very strong, so just prepare yourself for that. The next video, we'll take a break, we'll do some discussion after you watch the first video, and then we'll get into our next one that talks about drug use and homelessness and how those correlate together. So one thing to keep in mind as you're watching the videos, how do they relate with one another on the topics discussed? And then one thing that we're hoping for individuals to take away from today's session is you being a more informed community member, and what can you do, or what is your role in addressing substance abuse issues in your community. So hopefully we empower you a little bit to make more informed decisions. There's topics discussed that are, we talked a little bit about controversial issues, whether it's okay to legalize, whether it's not. We're not here to talk about, one or the other. It's to share information with you so that you yourself have more information. You have the ability to make an informed decision on your own. So there's different sides to both. So just keep that in mind when you're watching and taking in the information. The first video was created by the state of Idaho, actually, and the video talks about a lot of the issues going on in Colorado after they legalized marijuana. So Idaho, I guess you could say the video is them supporting the fact that they don't want to do that, they don't want to legalize, because you'll see all of the effects, the economic impact, the environmental impact that Denver's struggling with and going through, along with all the statistics that you'll see. So they created this video in hopes that they wanted to educate their community members so that they knew these things could happen if this was to be legalized in Idaho. So the opening credits, you'll see a lot of activities that Idaho does, their beautiful land. So think about the Menominee Reservation when you're looking at that, and there's some similarities that you can pull together and again, make more informed decisions for yourself. So any questions before we get started? So the first video is an hour long. Like I said, we'll stop after the first video, take a break, questions, and then we'll move on to the next one, okay? So after watching this video, I want to just generate some discussion at your tables to just talk a little bit about what you've seen today. So if you could just get together as a group, if you have a few people at your table, maybe come and move together with another group and talk about at least one thing in the video that you saw that contradicts that statement. What makes marijuana not safe? And maybe talk a little bit about something that you didn't really think about, or an impact that was new to you. Just healthy discussions at your table. I know that our ordinance recently changed and there was some decriminalization of marijuana that happened in our community. That does not mean that it is legal, and I think that's a huge issue that we have to educate our community on understanding what decriminalization means and what legalization means. So it's not legal to walk around with marijuana. There's just what is it, Jared, do you know what the amount?
Under 25 grams.
Under 25 grams, and you get a fine. So it's not an arrest, it's not legal, it's just at a certain level you get a fine and you still go through court proceedings and those kinds of things. So it's not legal here. So I think that's a big thing that we need to make sure that we communicate. I know I've talked to some of the legislatures about getting some more of that information out, and then, was that a good idea to do that? I mean, we've had some challenges as an agency with that change in our ordinances and some confusion. I think, again, we hear a lot of stories about people thinking that it is legal. It is legal, and we have law enforcement officers, like you heard at our last forum. They'll go into the home and individuals are using marijuana in front of them because they think it is legal. So again, the purpose of these forums is to get information to you so that you're more informed as an individual. Should the topic of legalization come up for Menominee or wherever you live, this is just helpful information. I don't think a lot of us think about these different impacts that it can have on the community, the environmental. That was the shocking piece that I took away. I didn't even think about how wildlife or how the forestry could be impacted by legalizing marijuana. So I think it's interesting just to get all this information and be prepared to answer those questions for the individuals that you work with. Just before we started, somebody had mentioned to me that they get that all the time. Oh, it's safe. I just do marijuana. It's not a big deal. And I think this information shows you a little bit deeper, it gives you a little deeper understanding of how it impacts the community and an individual as a whole. So the next video that we're going to watch, about the same time frame, so roughly an hour long. This is a look at the impacts of addiction and homelessness and how they correlate together. At the end of the video, it talks a lot about some of the efforts that we're going to be doing here in Menominee in regards to care coordination and getting services to individuals in jail systems. You'll see a lot of it's referenced to the prison system in the video. So it talks a lot about building supports for individuals who are engaged in programs and then transitioning them safely back into the community. So a lot of it, again, is our topics that we're talking about as a tribe and as programs working together to support individuals while they're engaged and while they're transitioning back into the community. So a lot of good information that links to what we're actually doing here as well.
Let me ask you something. What if Seattle is dying and we don't even know it? This story is about a seething, simmering anger that is now boiling over into outrage. Okay, so from what you saw in the video, they showed two different sides of community response or community reaction to addiction in these cities. One was pretty much turning a blind eye, right? Not really doing anything, kind of removing authority from their police officers. And then the other one was a balanced, more stringent system who did arrest individuals but had those built-in supports. And I think that's something that we need to look at as a community and make sure that we understand what's needed in order to help individuals who are struggling with addiction. Because these individuals are here where we live, those are our loved ones, those are family members, those are people that we care about. In our initial forums, we talked a little bit about the impacts of addiction on the brain, and you heard from the young woman who talked about not being okay with what she was doing when she was struggling with addiction, but it was overwhelming, and she was doing things that she normally wouldn't do. She was using substances she normally wouldn't to get through the day, and once she got through that, she could see again. She could help her family again, and she could be a meaningful contributor to her community. She works for the prevention program now. So these aren't
bad individuals. These are just individuals that we need to understand, and that's part of what we're doing, is helping you gain a better understanding of addiction and what it does, but also what can we do as a community and as a program. You know, we've done a lot of work with our social services department, our tribal jail, our tribal police department, in understanding and finding that balance between turning a blind eye and arresting our way out of the issue. And I think, you know, we've all heard that arresting your way out isn't going to work. So that's a fine balance we have to do as a team, and I'm excited because we have legislative members, we have tribal administration, we have programs right now where people understand that and are working together to create programs to support individuals after arrest is made, during treatment. And a big gap that's been here in our community is that aftercare support and services. And you heard, I believe his name was Michael, in the end talk about his caseworker, his manager, his doctor, all of these people in one facility, we're all talking together. And I think that's something that has been missing in our community, that we all try to do our best, and it's, you know, nobody's fault, but we all have our own little areas that we work in, and we're helping on an individual basis, where if we kind of do those wraparound services or care coordination and talk with one another and build supports for individuals, we put a lot of pressure on individuals in treatment after they're done. Okay, you're done, we'll transition you out. And then we expect them to be able to come back and continue. And I think that's something that as a program, and Manasakia has started to look at, is how do we support individuals once they transition out? Do we put that all on them? No, we're going to look at, you know, how can we contact them? How can we support them and get them and keep them in communication with whatever housing they need or education. So it's a lot that we can do as a community to help and communicate together. So I'm excited that we have people in these positions that are working together. You're going to hear a lot more about those programs. We have some social workers that are going to be placed at the police department, and they'll be riding along to provide some of those behavioral health services that are lacking. So a lot more communication, and it is a balance that we have to do. You can't just ignore it, obviously, because it's going to be there no matter if we ignore it or not. And you can't arrest your way out of it, because if you keep arresting individuals, they're in jail for a little while, they go out, you're not helping. You're not helping get at what the issue is. And a lot of times it roots back to addiction or mental health, and there's supports that we can do, again, because these are people that we care about, right? These are people that we're losing in our community, and there's a lot that we can do. So I think if there's anything that you can take away, is just maybe being more informed as a community member, how you can get involved. The planning group that works on the education forums, we do a lot of feedback. You know, we work on topics and whatnot, on feedback we get from you guys, because we want to get you the information that you're looking for to be more informed, more empowered to make decisions, and also to make a difference. And we're going to have those Menominee action plans coming into play and what our community needs. And I think being more informed about, you know, the background information and impacts that different situations or different approaches, it'll just make you more informed and be able to make a better decision individually what you believe in. So any questions on the video or anything that I talked about? So they talked about Vivitrol, Suboxone, and Methadone. And those are all but one are being utilized in our community. And in, not next month, but the following month, we'll have more information. We had a forum, was it two months ago, where Dr. Gunther talked in detail about Suboxone, and what it is, how it works. I don't know a lot about Suboxone specifically, so I don't want to talk in too much detail on it, but we will have resources for that, and you'll hear a lot more about Vivitrol and Methadone coming up in the next.
Your people here sell strips, and they sell their strips, and then they sell the liquid format. I don't know what the liquid one is, but
yeah, and that's an issue, and I think a lot of times medically assisted or medication assisted treatment programs get a bad name because there are horrible programs out there that are managing them. We've had issues with programs in Green Bay where they pretty much are just providing the substance and not coupling it with the therapy that's needed, the support that's needed. You can't just, fix addiction with a pill or a shot or a liquid form. It's something you have to balance and support ongoing. So we had a lot of, and you can ask some of our counselors, we have a table full over there, I'll point them out, they're always open for questions. But they see a lot of those programs that aren't managed well, and it's not helping anybody. They're still struggling with that addiction, and they end up going through worse withdrawals because they don't have tools, they don't have resources available to them to know how to handle sobriety, how to function in sobriety. So it's, again, a lot of support is needed, along with those medication-assisted treatment programs.
What is methadone?
Methadone is another form. So methadone and Suboxone are both a scheduled substance. So they're blockers. What they do is they block.
Can you use it to treat people who are heroin?
So they're opiates, anything related to opiates. Vivitrol can also be utilized for alcohol, and I believe the clinic is using Vivitrol as well as Suboxone.
Yes.
Diane, did you want to share a little bit more about your program?
Hi, I'm Diane, and I am on the team that works with the medically assisted treatment over at the clinic. And yes, we are using Suboxone at the clinic. And to answer the question, the difference between methadone and Suboxone, we do not have methadone in our community, and it's probably very doubtful that we ever will in the near future. Methadone is a highly regulated substance. This is not done like outside of a regular medical clinic. This is done in specialized clinics just for the methadone, and they're, like I said, they're very highly regulated. So right now, the thing that we can do in our community is do the Suboxone. And we have one provider, Dr. Gunther, who did talk to you a couple months ago, who has a special license to do that. He had to go through some special training to do that. And the big difference is all three of the drugs that they had up on the screen before work in a little bit different way. Methadone is completely an opioid. So when our receptors in the brain are telling us that we need those opioids, right, we're addicted, we've hardwired our brain to need those, the methadone is a complete opioid, and it will go in there and calm those blockers. And what we have found out is some of our folks that are really like using that daily injectable heroin and things, that might be the only thing that might help them for the rest of their life. And it kind of, we will hear the argument, are we replacing an addiction? Well, we maybe are replacing an addiction, but we're doing it in a regulated way, right? I mean, we heard last month how some of our heroin is now being mixed with fentanyl, and even worse, carfentanil and things. We are now giving this person who is severely addicted a chance because they're getting a regulated dose of a legal medication. They're followed by an entire team of doctors, psychiatrists, counselors, and they're able to function again. They're able to work, raise families, and become productive members of society. So methadone works by completely covering those opioid blockers in our mind, in our brain. We then go to Suboxone, which we do have available in our community, and we have that, that is a partial opioid blocker. So it is doing some of the same things. It is going in and it is really helping those areas of the brain that is screaming for those medications, the pain pills or the heroin. When you enter our clinic, you get a team in the medical of a doctor, a nurse, and a counselor. We have all three of them right in the medical department that you see every single time the patient comes in. We see our patients. We have very few that have been on the program for several months that we see twice a month, every 2 weeks. Mainly we see all of our patients every week. When they start out, we see them 2 and 3 times a week. They then have a counselor over in the behavior health department to start with that they see weekly, and we have substance use disorder groups that they are going through as well. So when they enter our program, they have a complete team of individuals that are available to them, every single day. And we really do like more or less the wraparound approach to that. So they always know that someone is available to talk to them if there is a crisis or a situation. And then finally the Vivitrol, and Vivitrol acts completely different. It's not an opioid at all. It works a little bit different in the brain, but it is helping the addict control those cravings. It works in the area of the brain where the cravings kind of originate. It is a once-a-month injection. It is a great medication because we can't divert that at all, right? If we come in, we get a shot, we can't be selling our scripts and, and our strips and our liquid is the methadone. So it is very good, but and that medication can be for opioid addiction or alcohol addiction as well. And we do know that they go hand in hand sometimes. For that, we do a pretty close follow-up with them as well. We get them into counseling. We really recommend that they are either, like doing like an AA group or an NA group, something like that, to really help them because we don't see them nearly as often, right? That is just a once-a-month injection. And we recently have started our patients, even when they start on the medically assisted program, it's not always very easy for them, right? They kind of slip back. We saw all the things about marijuana today. That's one of the issues that a small percentage of our patients have is they're having a hard time giving up their other substances in their life. It can help with the opioid cravings. We can't help with the other cravings quite yet medically. And so we are working now with Manasaikia with getting our patients that need that little more intense treatment. They maybe are having, some struggles that these medications are taking care of, and they need to be seen, maybe 3-4 times a week. So we're working now with Manasaikia on those patients as well.
How do you decide what person gets what? Does it depend on their addiction, who gets the...
Right, they would come in and we would go over, they would come in and see us in the medical department and we talk to them. We find out a little bit about their use and, what is going on in their home life. Sometimes, unfortunately, people do not have any support network or they don't have an area that they can go to where there's this, like a sober environment. So sometimes their only chance might be, residential treatment. If they do feel, and they are clearly told the expectations of our program because they're hard, right? We see them often. We are drug screening every chance we get. We're having them come in for strip counts. We don't want this stuff on the street, right? We want it highly regulated. We don't want to add to the police problem already. And so they know right up front what the expectations are. If they feel it's for them, we will have them come back in for just a very similar assessment like they do at Manasaikia, about an hour and a half, asking them about every aspect, of their life. And then we decide, from what the assessment, the clinical assessment tells us, if they would be a good match for a program, if they maybe need higher needs, like maybe the methadone program, or if they would need, the need for residential treatment. So, yeah, we do it through a counselor and assessment.
Does that stuff kick in for them right away, or does it help them right away, or
It
does
is
it go
pretty
a week or 2 weeks?
instant, no. When someone starts on Suboxone, that pretty much cuts that craving, right? Their dosing, it takes us a little bit. We start people on a low dose, right? Because you want to use the lowest dose that we can. So we will start them off. Most of them do good right away. Occasionally they'll come back, after that first week or two and say, in the evening they started getting cravings. Or they woke up at 2 in the morning and they were real anxious and restless. Well, then we know we have to step up that dose, just a little higher. But we do that very slowly. And so it may take us a little bit to get them to a dose that they are, 24 hours good, but they do see results quite instantly.
The strips, does that help with the cravings?
The strips will help with this cravings because they're a partial opioid. So they go in and attack those receptors in our brain, just like if we would use like a pain pill. Yeah, so they're just a partial opioid though. So that's how they kind of go in and they block those cravings. Nope, they are, remember what those old little Listerine things look like? Those little strips that you would put under your tongue? That's exactly what they are. Yeah, and you know, we help them do it the first few times. Our nurse Jane right here, she helps everybody. She teaches it how to do it. She, you know, checks and makes sure that they do them sometimes and they're not just sticking them in their pocket, you know, and whatnot. So, yeah, they learn how to properly take their medication. They only get a couple of days up to a week's medication at a time, and they better have it, or you know, that is reason to be asked to leave the program if we do have any suspicion of them selling, and we can prove that, not just by, you know, word on the street. But I think, and the counselors here can talk to, when we do see people who are buying Suboxone off the street, it is because they really are trying. You know, they're really trying themselves to get their addiction under control. Oftentimes, just that initial asking for help is one of the hardest things that the patient needs to do. So I don't know if you guys are kind of seeing the same thing, but a lot of times we do see that if you are buying it, that you are using it for the reason it's intended and not just to abuse it.
See, in the videos that we saw today, a lot of these substances are changing. You know, they talk about marijuana and how strong marijuana potency is now, the hybrids that are happening in the other substances, even opiates that are added in to marijuana. So, you know, things are becoming a lot different than they have been historically. You know, we've seen that at Manasapia, and so we're looking into a Vivitrol program so that we can offer a medication-assisted treatment, but we're taking our time to learn and understand all of the pieces of that. We want to make sure that we have a physician that understands and is trained. You know, like the clinic went through training and whatnot, so we're taking our time with launching that because we want to do it right. We want to couple it with the programs that we have now. So really making sure that we understand how they work, and we started with Vivitrol 1 because it's not a controlled substance, so it's kind of us dipping our toes in, being an abstinence-based program. So we're still learning, we're still taking a lot of that in ourselves. But things are changing and things are very scary, especially for individuals struggling with addiction. So I hope you got some useful information out of today.